Hello everyone, welcome to the Stepped Up Nurse Studios. I'm really excited to have you once again, and I want to say, if you have not subscribed to this YouTube channel, do well to subscribe right away, because you are going to be enjoying amazing nursing related content on this particular podcast. So today we have another amazing speaker. She is an erudite. She has had up to a decade. Is it 2 decades of nursing experience, if not more? 2 decades, right? So she's not your mate. Okay, except you are an elderly person with so many years of experience also. Most of what she'll be sharing today you will find relatable, right? And if you are a starting nurse or a student nurse watching this, I want you to pay attention so that you would pick out insights that will help you in your journey as a nurse. So today, welcome with me, Nurse Rukaiya Adeoti Akorede. She's an amazing personality. I met her in the process of Impact, and trust me, this woman is very amazing. I've never met her before, but the kind of support I got from her when we wanted to organize Link the Local Kaduna and SNA conference, it was actually mind-blowing. She's an amazing person, and she's so humble. That's the beautiful part. That's the most beautiful part of it. Welcome with me, Nurse Akorede. Thank you so much for deciding to be with us today. Kindly introduce yourself. Let's meet you, Ms. Akorede.
Okay, thank you, Nurse Adesua, for having me on this program. My name is Nurse Rukaiya Akorede. So I'm a psychiatric nurse, I'm a mother, and I'm also an addiction specialist enthusiast. So
wow, really? Addiction
counseling, yes.
Wow, so it means that you take care of people that are addicted to substance, to a particular substance.
Yes.
Right?
Yes.
To any substance, whether it's drug or alcohol, whatever,
yes.
Right?
Yes.
Wow, that's really amazing. So is it that you took certification courses for addiction, or right there when you were taking your psychiatric training, you now decided to focus on addiction? Where in your pathway did you decide on addiction?
Okay, so my being as addiction counselor just started let's say a year ago, when I was posted to the data unit in my hospital.
Oh, wow.
Okay. So I had to go and read more, get certification, and also get some more experience and skills so I can handle addiction and people suffering from addiction.
Oh, wow. That's really, really amazing. I think this is what we are going to talk about today. So today we are going to be talking about our experience as a psychiatric nurse. I think we will have you again, Nurse Akorede. We will have you on board again, maybe in the month of June or May or July. Whichever one is okay for you, we'll have you on board, please. So today we are going to be talking about our experience over the past 1 year, right? You've been practicing as an addiction counselor in data unit, right, for a year, right?
Yes.
Okay, that's really amazing. That's really nice, because recently I had an opportunity to meet with people that were discovered to be into substance abuse. They are young people. They are very young people in higher institution, and they were discovered to be into substance abuse. And the case, to me as a professional, as a nurse, it was not well handled. Tell me about your experience as a psychiatric nurse, and what has it been like comparing working down west and working in the north, as in your field. What's the difference working down in the west and working now in Kaduna State? What's the difference? I mean, as a psychiatric nurse.
Okay, so I was trained as a psychiatric nurse about 13 years ago, and while working as a registered nurse under Kaduna State government, so because I wasn't able to practice my psychiatry as required then, so I had to just move, let's say, seek other alternative by seeking appointment in a federal institution, which happened to the Medical Center in Abeokuta. So the difference being that while working in the north here under Kaduna State government, I only worked as a counselor handling patients with let's say PMTCT focal person. That was what I do. In fact, I was
PMTCT, that's prevention of mother to child transmission of HIV.
So I happen to be the focal person in our hospital there. In fact, I was awarded for being an impact award. I was given an impact award by CIHP then. So
wow,
I wasn't really satisfied because I wasn't really practicing my psychiatry as required. So that was what led me to Federal Medical Center in Abeokuta. So even though Federal Medical Center then was not having a psychiatric unit, but I had the opportunity of nursing psychiatric patients in the ward because being a Federal Medical Center, they had to admit any general case, any case, be it a psychiatric, any medical condition. So I had the opportunity. They have a psychiatry unit, but not a psychiatry ward. So I had the opportunity of seeing such cases, and my experience grew further, and I picked more interest in psychiatric nursing.
Okay, in the first place, what made you even go into psychiatric nursing? Why did you choose psychiatry?
Okay, let's say I had two reasons. The first one being, as a woman, you are married, you don't want to travel out of Kaduna to go and study some courses, maybe pediatric, which was my first intention. And the only was basic happened to be in Zaria, and I don't want to travel to Zaria. So then I had to just pick psychiatric that is in Kaduna. Then another thing is providing psychological support, because while working in the state, I observed that not all nurses are able to provide that psychological support to patients. Even if it's a pregnant woman that comes, there are levels of care that you need to give to that pregnant woman that helps in building their mental health and relieving their mental stress. So that's another aspect that pushed me into psychiatry, that if you are a psychiatrist, you'll be able to provide this counseling. You talk, you say they talk therapy, because talk is also a therapy. So that's another thing that made me go into psychiatry nursing.
That's really amazing. Okay, now that you have transitioned from working with pregnant women on PMTCT, that's prevention of mother. Okay, wait, before we even move to that question, what was it like talking to women? Because trust me, in this part of the world, they don't even see emotional and psychological health, mental health as something to give much attention to until you run mad, until you remove your clothes and enter the main road. They still keep thinking that you are fine. And I usually tell people there are lots of people that have mental illnesses that are walking around. They are bosses at work. They are patients on the bed. They are nurses. They are doctors. You understand? They are bankers. They have mental health issues, but they don't just have a diagnosis. What would you say about people that you met while they were pregnant, that did not even know that they needed psychological assessment or psychological help?
Yes, so my experience while working with the pregnant women or even general patients during antenatal is very vast, because sometimes you just see a woman when she came in for palpation, the next thing she just starts shedding tears. You're like, for you to lie down, let me check you. You are crying, so you are not really trained, or you are not emotionally intelligent to handle that patient. Madam, tashi, stand up and be going. But because of my background training as a psychiatric nurse, I had to sit down, ask them, what is your problem? What happened at home? What happened while on your way coming to the hospital? Did you lose something? In that process, when those women start telling you their problem, you know that is going on. So you have to just them, and by the time you are done, they say thank you.
Wow, that's really amazing, because trust me, in this part of the world where you have to attend to like 50 patients, 100 patients, 200 patients in a single shift. Tashi, don't waste my time. That's been the order of the day. What do you think?
Yes, ma'am.
Yeah, like what do you think? What should nurses do better in that area? They have a lot of patients to attend to. but they discover a patient that needs emotional support, just like when you discover a patient crying and then you have to sit down and ask questions. So people want to rush and say, oh, I have so many patients to see, I don't have time to sit down and be asking you why your head is paining you, or why you raise your leg up, or why you are crying. Where do we find the balance, helping nurses actually learn emotional intelligence?
So it all starts from our training, because there are some of these things that you don't get in school. You learn them while on the job. There are some things that you need to observe and learn it while on the job. As you are working, you know that this is a patient that needs more attention. This is a patient that just needs that attention, and she goes. Even some of those patients that you don't see it physically that they need this care. When you observe them from their tone, there are some triggers on the ground that needs to be addressed. So as nurses, our advice, while taking care of our patients generally, not only pregnant women, we should look at that innate that is in them, that non-verbal communication. Because sometimes when you are asking, it's just ordinary history, madam, what is your problem? What is your complaint? She starts crying. So you just have to know that we have a special case at hand, and every other ones can wait. If it's just that one woman you are able to save, or that one patient you are able to save that moment or that day, you have done a lot. So as nurses, I think we more, let's say, proactive when it comes to mental health and psychological support to all our clients.
Okay, what if in a situation where every unit has a psychiatric nurse or a psychiatric professional by the side? Because the example I cited in my last question, if they have a lot of patients to see, where will they find the balance? To refer immediately. You say, this patient, she needs your care, madam, let me take you to the counselor. She takes the patient to you, and the patient over to you, and then she goes back to her unit to continue what she was doing. Does that make sense? How can that be integrated into our healthcare system?
Yes, I think there was a time that they were talking about integrating mental health care into general, or let's say comprehensive care, because it is very, very important having a psychiatric department in every hospital, be it a federal institution, a primary or tertiary institution. It is very important.
Even private institutions
also needs it, but because of our economy and the condition, people always look for where that they have better pay. And looking at that, you will not be able to give the best if you have to go after the money. So it is your passion that matters. So if you are a psychiatric nurse and you are working in a private unit, you can advocate for you to have a psychiatric unit within that private hospital where you can provide a psychological support or mental health assessment clients that comes in.
Have you had situations where nurses themselves exhibit signs that you will say, you are my professional colleague, but I think you yourself, you need counseling? Have you had situations like that you see them exhibit, maybe they are under tension, they are under stress, and one thing or the other, and you as a psychiatric nurse that has specialty in that area, you could decode that this person needs help? Were there times you could actually help such colleagues?
Okay, yes, I could remember there was a time that we had a colleague that I was working with. He was having some, I think it's a financial challenge, because he will come to work, he's not really interested in the work, he's always complaining. And I think I had to call him and sit him down that, look, if your condition warrants you taking some time off to work, so you can sort your problem, I think it is the best. Because sometimes you can't have a burden in you and then be able to provide the good care that you need. There is something I learned about person-centered care. While taking care of somebody, you should think about yourself too. Your emotional state at that moment also matters. So my advice to him was, he took that, during that December, January off, so that he can sort out, this festive period. And by the time he comes back to work, early February, he was looking good. And I was like, what is the magic? He said, Kai, he really needed that off. So it helps. Of our colleagues,
what about situations where they could not get that off? If they could not secure that off from their workplace, some workplaces in Nigeria now, are already over choked, right? They are already overburdened. There's lots of workload on a nurse, and it's nearly impossible to take time off. What would be the solution for this kind of people? What do you recommend that the government do to help those people?
Yes, not only the government, it starts from our leaders. Our leader, me, you, everybody, we are all leaders. So if you are a supervisor, or let me say if you are my in charge, and you observe me, the way I'm acting is not usual way. This is a very lively man that comes to work, happy, jovial, and suddenly he becomes withdrawn. He's not attending to his clients. He's very agitated or maybe easily angered.
Yeah.
And you should call that nurse and ask him or her, what is your problem?
Questions.
How can we solve this? So if the in charge should put in that this patient needed this off, I think from the in charge to the immediate head of nursing or head of department, they will see reason why this nurse needs to go and rest, and they will give. Because I'm still saying, you can't give what you don't have. If you yourself are not mentally, emotionally stable, you cannot give the care required of you to take care of other patients. So it's better we also look at it that, okay, sometimes we all need this off. We need this rest off this work, so we can also put ourselves in order.
Thank you so much for sharing that. I really learned a lot from that, because trust me, the sad thing is that so many in charge, so many supervisors may not actually watch these videos. So we actually need to do our part to make sure that these people watch videos like this and actually take action, because it will not be good for you to be an in charge or be a supervisor and know that your nurses actually need help and do absolutely nothing about it, because you feel well, there's nothing I can do. What can I do? Am I the employer? I cannot employ new nurses now, so we just have to manage. There's nothing we can do about it. I think even if you cannot let that patient, that nurse go, there are some activities that can be carried out to help that person feel better,
or even relieve him of some duties
at that time, right? Yes. That's actually something I believe that a lot of people can do, especially managers, ward managers in charge, supervisors, and it's actually affecting nurses. Trust me, this minute as we are talking, one nurse, did I say one nurse? A lot of nurses are going through the same thing and they cannot speak out. Some nurses, at my place of work, we lost a patient some years back, okay, or some months back, many months back, and the person was on night duty and she just collapsed like that. And we had to start telling nurses that go and check your BP. When you just feel anything, just go and sit down and check your BP. Don't procrastinate. It's actually that bad. Please, I think if we keep talking about this, we can be on this topic for the next 1 hour. Share with us, how did your transition go from working with pregnant women and in PMTCT, giving them counseling, to moving to addiction? What has your experience been now that you are in data units? That's in Neuropsychiatric Hospital, Granawa, right? Kaduna State.
Federal data units are a neuropsychiatric unit. That was where I picked my passion for addiction. You see, addiction is something everywhere. It boils down from whether I've seen somebody of 14, 18 years into addiction, and this is a boy of SS2 bring a ground dealer of substance under the same roof with his parents. So it is something that needs to be addressed. A lot of parents, I don't know, even though we try our best, but society also have a way of preventing our children for us. So creating awareness about substance use is very important. Then aside that, a lot of these people that are into substance use, they are all finding ways of getting out of it. So my transitioning from PMT to addiction is something that is just that I just find it, the passion just grew in me, because I had to go and read more, get more certification on addiction recovery, so I can be able to give my best. Some of these patients, they are finding a way of going out of this addiction, but they cannot, because it is something that
they cannot help themselves.
And chemical, it has all the effects. Just yesterday, I saw somebody that is, I don't think she's up to 25. But because I'm the only person she could run to, she ran to me. She was drunk. She already rolled on the ground, and it was the bike man that even assisted her to my place. I had to pay money to this bike man because she also knows that this thing she's doing is wrong. But how did she get the media? The parents have washed their hands off her case. They say they are not going to assist her. So another thing with addiction recovery and treatment is that it is capital intensive. If you have parents that are not financially buoyant to take care of that such cases, you see them going back and going back. Some of these patients genuinely want to, but because of the emotional support they get from home, they don't trust them. You know, when she say, I go home now, it's another trouble. That's why I come to your place. I was like, what do I do? So after settling the bike man, I have nothing to do but just encourage her to go home and take a bath and clean herself up. I'm sure she'll go home.
Let me give you a news flash. Do you know I just started writing a book on substance abuse?
Wow.
After the experience that I had, that I saw that those people that were helpless, and I knew that they were supposed to take them to neuropsychiatric hospital for admission in data unit for at least 4 months or 5 months or 6 months at least until they get their feet back. When I saw that was not done, I really felt bad. I felt terrible, and I said, okay, what can I do as a solution to this problem? I said to write a book, and I said that okay, when I publish this book, I will take it back to that locality where I found that problem and see how I can give back. So I don't know, maybe you will join me in the writing of this book as a specialist in the area. Become co-authors. I didn't even have a psychiatric nurse on board, but the psychiatric nurse is not practicing as an addiction nurse. She's not an addiction counselor, neither is she working in neuropsychiatric hospital. So we believe that your own contributions, right, as a co-author, we make a world of difference. In fact, I intend to actually make questionnaires to share to certain people in that locality, so that we will gather information to know their perception, to know their practice about these things, so that when we are writing, we'll write from a base of quality information. I believe that yes,
another thing is that most of nurses, apart from being a psychiatric nurse, they need that specialized training on addiction for you to be able to handle addiction.
To help them.
Addiction, because you can't just you know, a general psychiatric does not give you that. Even though you have the basic knowledge of addiction and the counseling and the recovery, you still need that specialized training for you to get. You have the ISOP certification, then you have the ICAP. So all these certifications are very important. It gives you this edge ahead, so you can be able to identify the areas of needs of this patient. This addiction is not just only the patient that we look at. You look at it from the family angle. What is the duties of
yes
from community? Because communities stigmatize a lot. So you need to look at the community. How do they handle it? If they see such cases in the community, what do they do? Then within the hospital setting, how are they being handled? How are they being managed? Do they have opportunity? Some of these clients, after discharge from hospital, they don't come back for follow-up. They feel after all I'm back. So they need to work more on their revisits, getting a way of putting them back into the system, so they can be reminded of how to stay in recovery. Because staying in recovery is a very long journey. It's a long journey, and for them to be able to maintain that status, it needs a lot of reminder, a lot of caution, a lot of care, and also love. Because you have to show them love and care. At the same time, you have to let them know this is
wow, this is amazing. Nurse Akorede is like, I'm going to come and drag you. You will start your personal branding. Because by fire, by force. Because trust me, we need this. Sincerely, our environment needs this, and there is a very big knowledge gap in this area. A lot of people feel that if they take drugs, why you can't they take drugs? Should they not tell them what it's supposed to know? Has it not been warned? Has it not been told the right thing to do? Why is it intentionally deciding to take drugs? They don't know that this thing is like having a chronic illness. Like And it knows that you cannot even help yourself. They don't actually know that it's also a disease. They feel that it's something that the patient can control. Like you can tell yourself, stop it, and the thing will stop. It doesn't work like that. So thank you so much. To round up, I want to ask you a final question. Have you seen people that recovered? Like they recovered completely and they were ingrained back into the society?
Me, I know some people that are in high status in this Kaduna, under Kaduna state government, that are doing well after recovery. So,
wow.
So I know a lot of people that recovered. So because of the confidentiality, is we don't mention it, but you know, addiction it is teachable. It is something that is teachable and it needs a lot of commitment. Because if you make up your mind, stop, you can stop. You can stop. It requires a lot of work.
Thank you so much. Thank you so much. I know that if I keep talking like this, we'll be here for the next 1 hour. Thank you, Nurse Akorede. I know that we are going to have you on board again on this podcast. Thank you so much for sharing with us. And yes, we are going to bet that book. In fact, we are going to do so. Thank you so much for watching this afternoon. I believe that you have been able to learn a lot from this podcast. Please do well to share this video with your friends. See you in the next video.
Thank you.